And that's how I got to know the foundation. I know the foundation better through the work in the Platform for Better Oral Health in Europe. It's about advocating for oral health policies at the European level. So you can have an organization like the foundation that goes all along the spectrum, involving many different stakeholders, respecting everyone's views and trying to see how can we promote better oral health in the population. In that respect, anyone is very welcome, and anyone has something to bring to the table. It's not like the previous other groups I have been to, which is a learned society or almost a closed group. It's an open one. And I would like to use this opportunity and say, think about it. Because the foundation at the end of the day is just us. And I want you to leave the room today not thinking, oh, it's a nice they have the National Smile Month again. That's very good. And it's also, what can we make ourselves to make sure this continues and grows even further? So without further ado, let's talk about the National Smile Month. And actually, I cannot think of anyone better as a stable reference point for the foundation over the years than Nigel.
Thanks, George. Now, for the first time, I have a pre-written speech for me, but I understand that this is actually due to the wonders of artificial intelligence. I'll probably stick more to the intelligence up there than that. Those of you who don't know me and haven't met me before, which is probably very few in the room, I'm the long-standing chief executive of the Oral Health Foundation, and before that, previously the British Dental Health Foundation, before we changed the name. National Smile Month this year is in its 48th year, which really is quite remarkable. I have to say I was there at the beginning, so whether I'm still around by the time we get to 50, I don't know. Very interesting venue to be in here today. I do recommend all of you to spend a little bit of time before you leave looking around the venue and the museum downstairs. There really is some fascinating stories there, which I certainly didn't realise before I came into the building in terms of foundlings, how big a problem it was. And really, we can take that through, linking to George's comments, to the inequalities today. We're still in a situation where, with regards to poor oral health, it's socially disadvantaged groups that have a greater experience of oral disease. So I think it's quite an appropriate place for us to be in. Foundling Hospital, founded way back in the middle of the 18th century, and quite remarkably, I mean, we're talking about abandoned babies here, quite remarkably carried on into the 20th century. So that's quite salutary. So do spend some time, have a look around the building. There's some more stuff upstairs, and then the main museum is downstairs. National Smile Month really is a fun event with a serious underlying message. The underlying message clearly is about better oral health. The Foundation's motto and logo is better oral health for all. And that really is what we're all about. It's what we would like to see. We started, as I said, 48 years ago. It's grown from small beginnings in the Midlands to a national campaign, and offers an opportunity for everyone to get involved. Everyone that's working in oral care, we see practices having open days, inviting people who wouldn't normally go in through their door, attracting media attention as a result of that. We'll, I'm sure during the month, be getting high-level media coverage, both broadcast, print and online, and we look forward to that. Remarkably, even after 48 years, the coverage that we get grows year on year, and that's down to the skill education of our team and our comms team, led by David, who's trying to hide at the back there. And Sophie will also be amongst you. She's our digital media expert,
Sandwich.
And she'll be taking you pictures. But it's all about fun. So it's making that serious issue fun, getting those messages out there, taking them out to the broader population, breaking out of the constraints of the dental practice, going out holding events in schools, in shopping centres, and we'll hear more about the sort of on-the-ground activity that goes on. That's something new this year. We're going to hear from oral health educators on the ground, how they work with National Smile Month and what they manage to achieve. And that really is the core of it and how important it is. Great crowd here today, and thank you all for giving up time and visiting our sauna next door. There's a bit more air in this room. We've got loads of exciting activities lined up during the week, and really they do make a difference at all sorts of levels. From people going into schools, we have our year-round dental buddy educational program, which has huge numbers of downloads, but Smile Month's a focus for people who are going and doing oral health activity in schools. So we encourage all of you, whatever field you're in, to pick up on the themes of Smile Month. The theme this year is Love Your Smile. All sorts of reasons for loving the smile. I mean, the smile makes us feel happy. We know it takes a lot more muscles to frown than it does to smile. And we will be looking at how that value of the smile, having a nice smile, crosses across into all sorts of areas, not just in terms of the oral health itself, but in terms of mental health and well-being, because smiling and having a nice smile really makes us feel good. Unfortunately, one of our speakers today from Wrigley was taken ill last night and was unable to come. I've got my line already. I was going to introduce the two Bens, but I'm afraid you'll have to just put up with one Ben. Sorry, it's not Wrigley that's coming. It's the other Ben. I've got myself mixed up. The Ben who is here is going to talk on behalf of Wrigley, and many of you will know Dr. Ben Atkins, who is our previous, one of our previous presidents. Ben from Listerine, unfortunately, taken ill as able to be with us. So I'm going to hand over now to Ben to say a few words, and then we're going to come on to the people that really know what it's all about, the people on the ground. But as ever, there's a really big thank you to be said, and you will see all the sponsors on the screen there. This campaign could not take place without the Halion and all for their support. And the campaign wouldn't be running if it wasn't for this hugely valuable ongoing support from everybody who supports us. But now I'll hand over to Ben, you've heard enough from me.
It's a great pleasure to come to speak today. It's an honor to be not representing the Oral Health Foundation. One of my most highlights of my career has been being a trustee of the Oral Health Foundation. And I'd encourage anybody to become a trustee. It's a real highlight, and I hope it's a really amazing diverse board. And there's some YouTube conversation, but it's in a safe environment, so it's really good fun. So without further ado, today to talk about the Wrigley Oral Health Foundation. The program itself it funds independent research. It supports continuous professional development and shares educational material, not just for professionals, but for patients as well. It works on promoting oral health within our profession, with the community, and it has a really good role to link in with our patients, because they recognize the brands, trustable brands, and often where we can't get access to. Recent research, there's been a program of economic study and fiscal benefits on promoting sugar-free gum, on rolling out supervised brushing campaign, and also fluoridating more water supply. And it's really interesting how looking at oral health from a different angle is really, really important. And that's one of the things I've learned over the years, working with industry, on how everyone looks at our industry slightly differently, whether you're a patient, whether you guys support them in such a big role. The program itself carried out 2 major studies over the past 4 years, because it's giving us a snapshot into the nation's oral health. And it's something that I felt really valuable, because it gives us, enables to get an idea of what's going on in patients' minds, what's going on their patients' views, how important do they think the smiles are, their teeth, their oral health condition. And there's lots of results and how we can use those stats, especially in the media, to be a discussion point. And working with Nigel and Dave and his team has been something we have used to have it as a stimulus. So, for example, talking about investment in services, showing how important it is for patients they value their mouth. So that investment is really, really important. Understanding what patients want. Without that, we can't move forward. So the Oral Health Index has been a really good, valuable tool to find those viewpoints that maybe we can't talk about dentists to our patients. There's a clear mandate. It gives us an ambitious action plan and something to all bear in mind, especially when we're in such a really valuable month, National Smile Month. 30% of patients don't brush their teeth twice a day. Little snapshots like that make patients think, well, I should brush my teeth twice a day. Collecting data on people's mental health. So the latest Oral Health Index has looked at the link between mental health and that people smile, their mouth. And it shows that people really do value, they worry about it. A third English population stated that the oral health is causing them high stress or anxiety. Over 60% of the parents, they worry about their children's mouth. And it's that communication that National Smile Month gives that real value of how important things are, how we can alleviate it from a patient perspective. One of the great learnings that I've had from the Oral Health Foundation, especially with Nigel, is speaking simply to our patients. And that's what the Smile Month enables me as a dentist to do that for our patients. 1 in 5 patients reported missing work in the last 3 years due to dental problems. 1 in 10 adults have at least taken 2 weeks off work through dental issues. That rate doubles between 16 and 34-year-olds. We're in a modern society, that shouldn't happen, and National Smile Month empowers us to communicate with our patients, which is why the Wrigley Oral Healthcare Programme supports National Smile Month, and we really value working with them.
Finally, and as I said, something new for this year, we're going to actually hear from the people who actually implement National Smile Month on the ground, and long-term supporters of National Smile Month, the Whittington Health NHS Trust. And we have 3 of them here today: Sally McGregor, Louise McLean, and Emma Proudfoot, and we're really looking forward to hearing how they take the principles of National Smile Month, get out there into the community and make a difference. Over to you.
Good afternoon, everybody. We would like to start by saying thank you to the Oral Health Foundation for inviting us to come for to you today. We are the Whittington Community Dental Service Oral Health Promotion Team. We are a team of 15, there's 14 oral health promoters and 1 oral health promotion lead, and we cover 9 North London boroughs. So we cover Camden, Islington, Ealing, Harrow, Hounslow and Newton, Brent, and Haringey and Enfield. generation of children that is free from dental disease to improve oral health outcomes for all ages with education, promotion and prevention. So how do we do this? We promote evidence-based intervention through programs like supervised toothbrushing programs in early years and school settings. We have thousands of children that are signed up to our supervised toothbrushing program all over all of the 9 boroughs that we work in. Fluoride Varnish program. We have been doing fluoride varnish in schools for many, many years, and we have seen an incredible difference. Oral health training to staff for early years teams in lots of different settings, children and adult services, in healthcare and social and education. Outreach and education for parents, so we run lots of workshops, and since COVID, we've run lots of online workshops, which we have found really beneficial to parents. Because sometimes it's really difficult for them to come and speak to us in different settings, so if we run these workshops online, we found we get a lot of uptake. Vulnerable adults, we work with lots of vulnerable adults, we work with homeless, we work with lots of STEM children as well, and supporting local and national campaigns like We Are Today. So it's all about keeping mouths healthy and smiles healthy, so free from dental caries and gum disease. Promoting twice a day daily toothbrush is really, really important for us. Reinforcing healthy eating, encouraging visits to the dentist, and just advising everybody and showing everybody that our mouth is the window to our health. Right, so what does National Smile Month mean to us? National Smile Month is our very own festival. It's our festival of oral health. So we're partying hard this month. We are out and about to all different areas. Our stakeholders take part. We do activities, events, online, face-to-face, and more importantly, making it fun, making that message fun and achievable by spreading it in a fun way. So what things we do? We have a brush bus, and that is what it says. It's a bus. We do fluoride treatment, and we have other people there. So we have library staff, social workers. As we know, oral health isn't just about your mouth. It's that mental, it's that whole awareness as well. We do activity packs for children. We do brush-a-thons. We did our last brush-a-thon, and we had 900 children join us online. So that's a massive achievement in one day and an afternoon. We do online sessions, as we said, and they're really powerful because not all parents can go to a school or go to a library or go to different places. So having it online, and especially in the evening, is really powerful. So we're getting those parents and carers to us. We do story time at libraries, we do school workshops, we work in different clinics, we go to hospitals as well, and we design poster competitions for children, getting them involved in that way. They all like a prize, that's really good, and have story time, and we go to children's centres and family wellbeing places as well. And here's our picture from us last year. Thank you, another one there is, another picture. And here we have one of our other oral health promoters at different events. Big one for teenagers. They're quite hard-hitting audience to get teenagers with oral health. So we have little things like high and low sugar. We have our lovely Ben that did a little talk for us as well last year for teenagers, and just out and about in the community. Another picture. So this is at one of our clinics, and this is at Whittington Hospital, where we had about 5 schools come to us, and we went to different departments in the hospital as well. So not just seeing like children and parents, but also other healthcare professionals. We want that message to be exactly the same all the way through. We're really, really excited because we have a partnership with Mesa, who's the author of Dinosaur Douglas and Beaky Bugs. If you haven't read it, please do. Oral Health Foundation stock it. It's an absolutely amazing story. Most perfect messages in to support our oral health. So Heather has really kindly recorded a reading, which we're able to use during National Smile Month, and she's done some live readings for us as well. So the children, they get so much out of it because the author is reading it, and the teacher does the school of it. It's just such an amazing story. We're very fortunate. As my colleague said, we design competitions. Here's just a couple of entries from our competition. We always base it around the National Smile Month theme.
This year it's Love Your Smile, and I'm really pleased to say that my email has been going crazy with entries already. I only sent it out on Monday, and I've already got a whole pile of entries, so that's fantastic. As we've already mentioned, we cover lots and lots of different sort of events during National Smile Month. What we also do is we do TikToks here at the Wizards as well. And we thought, how can we took last year's message and thought, Russia's on, okay, so how can we kind of put our own little slant on that? What we thought, let's lead by example. Let's get our dental team brushing their teeth, okay? So we had a video of all of our dental team brushing their teeth, okay, that we were able then to share out into our venues. And it went out absolutely strong. Because we're leading from example, we had our admin team, we had our managers, we had our dentists, we had our dental nurses, and it was absolutely amazing. Oral health, yes, it's for people, but as you can see in the middle there, it's not Pixie. Pixie is my own sausage dog, okay, and also oral health is really, really important as well for our pets, because we love our pets, okay, so we want them to be healthy. And we were talking earlier about the stats on taking dog teeth out. So, you know, we really want them to be healthy. So it's important when we're talking to everyone, let's get those messages out there. Let's put some components to people. Just finally, the importance of a smile. Now, we in the room, we know it's so important. We're giving these messages every day. That releasing endorphins, the natural mood boosters. It reduces stress. We're hearing so much about that these days, okay? And smiling boosts our mood. And when we're going out to our venues, smiling is contagious. So we're saying to our children, come on, catch a smile. You know, and in the end, that gives everybody awesome. So it's amazing. It takes more muscles to frown, okay, as Nigel mentioned earlier, and it boosts your self-confidence, and it really makes you happy. So everybody, I would urge you all, go out there today, love your smile, everyone, okay, and you never know, everyone might catch it. Okay, so thank you so much.
Thank you so much for that. Your enthusiasm is incredible. Wish we'd got teams all over the country that was enthusiastic and involved at really carrying those messages out there. Actually, you don't have to live in North London to enter an art competition. We have a fun Smile Art contest this year, which is open to everyone, and we invite you all to participate. But you've heard enough from me. That really is the end of the formal proceedings today. As I said, Sophie here, our media guru, is going to be going around taking pictures. Do enjoy some more of the food before you go. And in particular, I would advise everybody to have a look around the museum, because it really is fascinating what from Thomas Coram's beginning actually occurred and really lasting memory within this museum today. So do have a look at it. Thank you all once again for coming. Thanks again to all of my staff team for the efforts that they put into Smile Month, which doesn't just happen overnight. There's a lot of work goes on behind the scenes, and